Hi, my name is Dr. Janae Zelaya. I'm an Arasi certified provider here in San Antonio, Texas. And today we'll be talking about sciatica, which I'm sure you or a loved one has definitely heard of this term before. First things first, sciatica is actually a symptom secondary to some other condition. Figuring out that first will unsolve the puzzle. Did you know that the sciatic nerve is the largest and longest nerve in your body, and it's as thick as your pinky? It's made up of several spinal nerves that converge, and it runs deep to the glutes, down the back of the thigh, where it branches off and continues to your foot. And in some folks, it actually pierces the piriformis muscle, which can be a complicating factor. Patients with sciatic symptoms generally report the shooting pain, numbness or tingling down from the low back to the glutes, all the way down to the foot along the sciatic nerve. Research states that majority of patients who have sciatic symptoms is actually secondary to a disc herniation. Other common causes are degenerative disc disease, which is the narrowing of the space between each vertebra in your spine. Also, lumbar spinal stenosis, which is narrowing of the spinal canal in the low back. Also, piriformis syndrome, which is just tightness of the piriformis, which can compress on the sciatic nerve, and it's actually termed pseudosciatica. Now, let's go over 3 simple exercises that you can do if you have any of these issues. All right, the first exercise is foam rolling of the glutes and the piriformis for mobility. First, you're gonna start with sitting on the foam roller. So you're gonna cross the right ankle over the left ankle, and you can also lean towards the right for added pressure. You're gonna scan the gluteal region for tender spots. When you find a tender spot, you're gonna hold and oscillate for 5 to 10 seconds. If you want more of a challenge, you can actually bring the ankle above the knee in a figure 4 position and also lean more towards that side. You can also do the opposite side and do this for a total of 2 minutes. All right, for the second exercise, we're gonna be doing a stretch called a figure 4 stretch. So you're gonna start in a seated position and you're gonna cross your right ankle above the left knee in a figure 4. From here, you wanna make sure that you're sitting up nice and straight. And what you're trying to do is you're actually trying to put your chest over your lower body. You can even apply pressure on that right knee for increase of stretch. This is really great for patients who have a job that consists of prolonged sitting. You can do this for a total duration of 2 minutes, and then you can switch sides. All right, and for the final third exercise, it's called a basic glute bridge. You're gonna start with laying on your back, you're gonna bend your knees, and at this point, you're gonna contract the abs and your glutes, and you can even give yourself some tactile feedback to make sure they're both engaged. From here, you're gonna lift the pelvis up to the ceiling while holding this contraction. When you're at the very top, you're gonna hold for 3 to 5 seconds. And then from there, you're gonna lower back to starting position while maintaining this contraction. At this point, you can actually reset and repeat, and you're gonna do a total of 2 sets of 10. Thank you for joining me in today's video.